Welcome you all to Discover channel. If you new to our channel, subscribe and hit the bell icon. Without any further delay, let's get started. At present days our health is more pivotal. Now World Trade Health Organization found a disease which affects Bangladesh. Let's know what happened, how it's widespread over Bangladesh. But for your remembrance, if you new or existing subscribers, give your thumbs up to upload more content. Nipah virus infection outbreaks are seasonal in Bangladesh, with cases usually occurring annually between December and May. Since the report of the first case in 2001, the number of yearly cases has ranged from 0 to 67, though in the last 5 years, reported cases have been comparatively lower, ranging from 0 in 2016 to 8 in 2019. However, since the 4th of January 2023 and as of the 13th of February 2023, 11 cases, 10 confirmed and 1 probable, including 8 deaths, case fatality rate, CFR, 73%, have been reported across 2 divisions in Bangladesh. A multisectoral response has been implemented by the Ministry of Health and Family Welfare, Bangladesh, including strengthened surveillance activities, case management, infection prevention and control, and implementation of risk communication campaigns. WHO assesses the risk as high at the national level, moderate at the regional level, and low at the global level. Since 2001, Bangladesh has been reporting seasonal outbreaks of Nipah virus infection between December and May, corresponding with the harvesting season of date palm sap (DPS) occurring in the country from November to March. Reported cases ranged from 0 in 2002, 2006 and 2016 to 67 in 2004. A lower number of reported cases was observed from 2016 following an extensive advocacy campaign against the consumption of raw date palm sap. However, between the 4th of January to the 13th of February 2023, a total of 10 confirmed and 1 probable cases of Nipah virus infection, including 8 deaths, CFR 73%, were reported from 7 districts across 2 divisions in Bangladesh. This is the highest number of cases since 2015, when 15 cases including 11 deaths were reported. 10 of the 11 reported cases were laboratory confirmed, while samples could not be collected from 1 case before death and is therefore considered a probable case based on epidemiological linkage. Laboratory confirmation of Nipah virus infection was carried out through real-time polymerase chain reaction (RT-PCR) using samples from throat swabs and antibody detection via enzyme-linked immunosorbent assay (ELISA). Confirmatory tests were done at the Institute of Epidemiology, Disease Control and Research (IEDCR) and International Center for Diarrheal Disease Research, Bangladesh, ICDDR-B, laboratories. 6 cases were reported from Dhaka division, including 4 deaths from the districts of Narsingdi, 1 case who died, Rajbari, 4 cases including 3 deaths, and Shariatpur, 1 case. Rajshahi division reported 5 cases including 4 deaths from the districts of Naugaon, 2 cases including 1 death, Nator, 1 case who died, Pabna, 1 case who died, and Rajshahi, 1 case who died. Figure 2. Nipah virus infection is an emerging bat-borne zoonotic disease transmitted to humans through infected animals or contaminated food. It can also be transmitted directly from person to person through close contact with an infected person. Fruit bats or flying foxes, Pteropodidae species, are the natural hosts for Nipah virus. The incubation period is believed to range from 4 to 14 days. However, an incubation period up to 45 days has been reported. Laboratory diagnosis of a patient with a clinical history of Nipah virus infection can be made during the acute and convalescent phases of the disease by using a combination of tests. The main tests used are RT-PCR from bodily fluids and antibody detection via ELISA. Nipah virus infection in humans causes a range of clinical presentations, from asymptomatic infection, subclinical, to acute respiratory infection and fatal encephalitis. Infected people initially develop symptoms including fever, headaches, myalgia, muscle pain, vomiting, and sore throat. This can be followed by dizziness, drowsiness, altered consciousness, and neurological signs that indicate acute encephalitis. Some people can also experience atypical pneumonia and severe respiratory problems, including acute respiratory distress. Encephalitis and seizures occur in severe cases, progressing to coma within 24 to 48 hours. Most people who survive acute encephalitis make a full recovery, but long-term neurologic conditions have been reported in survivors. Approximately 20% of patients are left with residual neurological consequences such as seizure disorder and personality changes. A small number of people who recover subsequently relapse or develop delayed onset encephalitis. The overall global case fatality rate is estimated at 40% to 75% depending on local capabilities for epidemiological surveillance and clinical management. Although antivirals are in development, there are no licensed vaccines or therapeutics available for the prevention or treatment of Nipah virus infection. I request you all to be more cognizant and stay tuned with a healthy life. At present days, our health is our wealth. Have a great weekend. If you want more videos, subscribe to our channel for the regular updates.